Hey Central Virginia, if you suffer with foot pain from peripheral neuropathy, then this video is for you. I'm Dr. Keith Lynch and I'm going to talk to you about our natural solutions for peripheral neuropathy pain. So in this video we're going to talk about what causes peripheral neuropathy and what can be done about it. So peripheral neuropathy is very common. We see it in millions of Americans and it's kind of like a wiring problem. It's a nerve issue where the nerves stop working properly and are constantly firing pain signals up to the brain. So if you have peripheral neuropathy, you already know what these symptoms are. Burning, cramping, electric pain, difficulty walking, loss of balance, tingling, burning. Let's talk about those nerves because that's what's happening here. We've got several different types of nerves. You've got motor nerves, sensory nerves, and you also have nerves that go to organs, and those are autonomic nerves. And when we talk about a nerve condition, we have to talk about the metabolism of the cells. And when we talk about metabolism, we're really talking about how you turn food into energy, because that's an important aspect of it. Because 30% of our nervous system, 30% of our energy goes to your nervous system. I'm going to give you the answer. And we need proper metabolism or proper cell function for those nerves to work right, especially if we have a chronic condition and we want to try to get it better. So the causes of peripheral neuropathy, I'm going to break this down really quick. In peripheral neuropathy foot pain, there's two things happening. You have small nerves which carry pain and temperature that go up to the brain. And then you also have bigger nerves called large diameter afferents that have a sheathing that goes around them made up of cholesterol, and those nerves send information as far as joint position sense, drag, light touch, vibration are all carried on those nerves, and they make it to the brain faster than pain and temperature, which creates the pain gate theory. And that's how it works. So when those nerves are working, you're not going to feel the pain. But if those nerves die off, then pain and temperature are constantly firing up to the brain. And if you have peripheral neuropathy, I don't need to tell you what that feels like because you already know. And if it's your spouse or loved one, you know because I'm sure they've already told you what they experience. And it can come from statin drugs. Those nerves have that sheathing on the outside of it. Statin drugs, in 2002, there was an article that said 16 times more prevalent to have peripheral neuropathy if you're on a statin drug. That's huge. These things are tearing people's nerves up. Also, those nerves that go down your feet come out through your low back. So if you've had an injury in your back, arthritis, slipped disc, stenosis, then that can also be contributing to your issues. Now, if you have diabetes, insulin resistance, if you have chronic inflammation or had chemotherapy, all of those things are going to contribute to that condition. So with chronic inflammation, you've got food sensitivities, inflammatory food diets, hidden infections, poor omega fatty acid ratios, and insulin and hormone imbalances all lead to those problems. So if you've got inflammation, you've got to address the inflammation to heal this. And that's what we're talking about, is getting your body to heal while you have this chronic condition. Because certain foods are going to create inflammation that contribute, not cause, it's contributing to it. Because right now, if you have peripheral neuropathy and you're taking gabapentin, Lyrica, or Neurontin, that's it. That's all you're doing for those nerves. And that doesn't heal them, that just helps block pain. So peripheral neuropathy is a progressive condition. So that means that this thing is just getting worse and we're not paying attention to it. If you want to get this better, you have to make these choices. You have to be the one that's going to get yourself so that you're not creating inflammation so that your body has the opportunity to heal. And that's why we're talking about it. So we actually will do blood work with you to make sure that you don't have some of those issues, because this is an uphill battle, and we've got to fight it so that you can win it and get out of that pain so you can get back to doing the things you want to do. You want to be more active with your kids and your grandkids. You want to get back out there golfing, playing tennis, or at least more active and independent, because that's what these things do. They start robbing your activities and your independence, and then all you have to do is to sit around with your foot pain. I'm trying to help you with that, so that's why we're going to do blood work to try to fix that and help your body heal. And if you've been told that your blood's all normal, I'm telling you, they're only comparing you to the ranges of pathology, which means if you're outside in these red areas, there's a problem. But if you're on the outside of what's good, there's also a problem, and that never gets addressed. In our office, we look for those things because those are the hidden things that are going to stop you from getting well. Your brain is connected to every cell in the body. What happens when some of those nerves that attach to your brain stop working? Well, it creates a comorbidity situation, meaning if you have one problem, you're very likely going to develop another one. And let's look at what those are. Loss of balance, memory loss, depression, anxiety, Alzheimer's, dementia, and insomnia all run along with peripheral neuropathy, meaning if you have it long enough, this is what's in your future. So by all means, you want to do everything you can to get your body to heal and get those feet working better and feeling better. So if we're trying to heal those nerves, what do we need? Well, nerves need fuel. So that's glucose and oxygen. That's an activation. And that's what our program is about. The HacoMed microcurrent technology that we're currently using has been a game changer for peripheral neuropathy. It stimulates those large diameter afferent nerves to improve nerve function. Those are your pain inhibitory pathway. If you don't have that, it's not going to get better. People say, what does that mean, pain inhibitory pathway? Hit your funny bone against something. Whack it on a chair or a table. You will immediately grab it with your hand. And when you're doing that, you're moving your hand around, you're moving the joint around. Why are you doing that? Because joint position sense, light touch, drag, all are part of your large diameter afferents. And if you whack that elbow, I dare you not to touch it and don't move it around. Just hold it still. It'll feel like you're going to go through the roof. As soon as you put your hand on there, it starts to feel better. That's how this technology works. It helps those nerves heal. We also use cold laser. We have a super pulsed laser that we use that also improves blood flow. It helps the body heal. It helps those nerves heal. And it increases ATP, which is the cellular energy in those nerves it's low. It needs to be improved. So that's part of what we're doing. We also have a peripheral nerve rebuilding therapy. So not only are you going to get the HacoMed horizontal microcurrent here in the office, but we're going to give you a home unit. So on days when you're not in here getting the treatment, you have that treatment to do at home. And guess what? When the program is over, you also still have that unit at home so that you can continue to do that from time to time. Plus all the information we give you about diet, you can continue with, so that we're not just treating you, then when you're done, you're done. This is giving you the roadmap, the blueprint on how to go forward and live your best life and be as healthy as you possibly can be. The rest of the program is going to include some essential fatty acids, as well as any other things that we find based on your blood testing that are going to help your body heal. So the key points I want you to know is that it's going to take many different things to move this condition forward and get rid of that pain. Not just one thing will do it. You've got to address it both neurologically and metabolically. The condition is progressive. You had it, you know what it started to feel like, you know what it feels like now. You got to imagine what it's going to be like in 3 years. It's going to get worse. Our program is comprehensive, and I believe it to be state-of-the-art. This is what we need to do to get your body working properly again. All the different treatments, as well as improving your diet. It all starts with a neurological exam. We do the Toronto scoring exam in our office because I like to have a number to work with. If everything is perfect and all the nerves are working properly, you should score a 74. People with peripheral neuropathy don't. I see 30s, I see 40s, I see 20s. If you're below a 12, I won't take you. That means the condition has progressed so bad that I don't believe what we're going to be able to do is going to help you. And I will tell you that. If you're above that, I still think that you can be helped. So come on in and find out how you are and where you are on this scale. The condition is progressive. It's just getting worse. Act now and do something about it. Call our office at 434-245-8456 for your appointment so that we can find out where you are and find out whether or not you're a candidate to get rid of your peripheral neuropathy foot pain. On your first visit, you will get that evaluation. If you have any existing, meaning within the last 6 months, lab work, bring it in with you. You're also going to fill out a metabolic assessment form that I will review. And I recommend you bring your spouse or significant other with you. If you're doing this, you're going to be changing your diet. You're committing to a lot. The people in your life need to know about it. If you're doing it unsupported, it usually doesn't go well. I only take a couple of people on a month. I have a busy chiropractic practice, but this is my passion. I love helping people. If you are willing to make these changes, I'm here to help you. These services normally cost over $450. This excludes federal beneficiaries. If you watch this workshop, I'd be willing to do it for $77. Call our office, tell us you want the peripheral neuropathy examination, and that's what we'll get for you. But you need to think about it. On a scale of 1 to 10, how serious are you about this? Where do you see yourself in 3 years? It's progressive. How's this affected your relationship, your work, your ability to enjoy your life? Remember, we're talking about your activities. This is what you do during the day. This is your life. Your independence. Think of 3 things that you could do if you weren't having this kind of pain. So you've got to really be willing to do it. I encourage you not to sign up for this if you don't think you're willing to do everything it takes to get this better. Call our office, get the evaluation. My name's Dr. Lynch. I look forward to meeting you, and I look forward to helping you. Thanks.